As we've been reporting, the CDC has authorized a second COVID-19 booster shot for adults age 50 and older. And this all comes amid that new CDC data showing the Omicron subvariant BA.2 is now the dominant strain of COVID in the U.S., accounting for more than half of all new infections, particularly high in New York and New Jersey and other parts of the Northeast.
So let's bring in now, welcome on this National Doctors Day, the newly installed Commissioner of the New York City Department of Health and Mental Hygiene, Dr. Ashwin Vasan. Sir, good to have you here with us. Thanks for being in studio.
Good afternoon. Thanks for having me.
Just on the job, how is New York doing when it comes to this new variant? Not just the numbers of the percentage it accounts for of new cases, but also what's it doing to our hospitalizations and severe illness? Is it having a real impact yet?
Yeah, thanks for the question. And, you know, I think you just talked about the CDC data. The BA.2 subvariant of Omicron is here. It's making up the majority of cases, and we can see it travels faster than previous variants, the original Omicron variant. We are seeing cases rise. The good news is that we are still seeing our hospitalization rates and our bed occupancy rates, meaning the space we have in our healthcare system, relatively low. So overall, we still remain in a low-risk environment, but we're watching that data every day as we make these decisions around policies and recommendations to New Yorkers.
And speaking of policies and new decisions, we know that beginning next week, masks for children under the age of 5 will no longer be mandated in places like nursery schools and daycare facilities. And on that day that announcement was made, you tweeted this, and I want to read it out loud. Let's be respectful of whatever choices families make. Let's be kind to each other when it comes to how we manage our own risk. You don't know what life circumstances someone might be accounting for in their choice to mask. Was that prompted by past behavior you've witnessed, and what are you anticipating from parents?
I think that was prompted first and foremost as a father. I have 3 school-age kids. One of them is 2.5, who is affected by our mask rules. And I know that these are not easy choices for us as a city. They're also not easy choices for parents. But I know that whatever we do as a city and as making recommendations and policies, we have to respect one another's level of risk, comfort. We don't know what folks are dealing with in their household and in their community, so we need to respect one another at this time of division and the choices we make about managing our own risk. So that's incredibly important. And it's a very personal issue for us, for me as a father in particular.
Let me ask you as well, something that's been a lot of attention here, and we know now Kyrie can play. There's an exception being made now to this, to the private employer mandate. That's an exception for athletes and entertainers, essentially. And a lot of people took issue with this, like, wait, you make an exception for them, but what about the city's teachers and others who lost jobs because they didn't want to get a vaccine? Can you explain the decision behind making an exception for athletes and entertainers when it comes to a vaccine mandate?
I think the mayor made a decision that really leveled the playing field from a previous rule that was pretty unfair to allow an exception for non-residents versus residents. I'll also say, as the city's doctor, my recommendation to everyone, regardless of the field of play, where you work, what you do, is get vaccinated. Number one, that is our best tool to keep ourselves safe, to keep our families safe, and to prevent severe illness and death. I'd also say, as a sports fan, the reason we're even talking about an uninterrupted season and the playoffs, and we're looking forward to a baseball season, is because the vast majority of players, I think above 98, 99% in the NBA and Major League Baseball, have gotten vaccinated. So that's our best tool, and I'll continue to advocate for that.
Dr. Vasan, you referred to mental health as the second pandemic. Can you give us a sense of what you've seen, what you've witnessed in terms of how people have had to deal with what we've all been through, some struggling more than others? What's out there for them? What do you hope comes from this in terms of awareness and help?
I think this is an all-hands-on-deck moment for mental health. It truly is a second pandemic that we're going to be dealing with for years to come. It's going to fall on our children in particular, and as a father who has watched the impacts of the pandemic on my own kids, it's a very real thing. As someone who's also had members of his family deal with mental health struggles, you know, I have seen the effects of isolation and, feeling disconnected from others on long-term health and well-being. This is a time for us as a as a city, as a nation, to come together and rebuild our mental health system. I'm so encouraged by the messages I'm hearing, not only from our administration, but from the president talking about mental health at the State of the Union. This is an all-hands-on-deck moment at every level of government as well as society to step up and finally get people access to the mental health care they need when they need it, in the ways they need it, and to start talking about what's causing these mental health crises to begin with.
Doctor, when do you still wear a mask? I know it's a personal decision for everybody, with their level of comfort, but besides the places where we're required to, when are you feel comfortable having it off or having it on? Some people still walk down the street outside and want it on. But for you personally, when do you still wear a mask?
Yeah, it's a good question. I mean, I tend, when I don't know the vaccination status of the people around me and I'm in a closed setting with an indoor space, I tend to wear a mask. I came onto your set today after getting a rapid test. So I also want to tell people that the best way to take off that mask is also to use rapid at-home testing. You can test those around you. You wait 15 minutes, and then you can take off that mask with some level of confidence that we can engage in a more routine and normal way. So I think it's a very fair question.
All right, thank you so much. And again, New York City Health Commissioner Dr. Ashwin Vasan, we appreciate you coming in with us today.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.